For years now, Americans have been telling us all across the country that Obamacare's failed. It's failed families. If you look at what it's done in the practice of medicine, we've seen so many doctors leaving the practice of medicine. In fact, a lot of them have ran for Congress and got elected to Congress to come and help rescue people across this country from the failures of Obamacare. And the good news is we've been listening to them, and we've committed that if we finally get the opportunity with the Republican House and Senate and White House, that we would repeal this law and actually replace it with reforms that put patients back in charge of their health care decisions. Healthcare decisions are too important to be made by unelected bureaucrats here in Washington. And what we're working on is legislation that will actually put that control back in the hands of families and patients and get it out of the hands of these unelected bureaucrats. And we're focused on lowering costs for families. One of the biggest failures of Obamacare is that it's made healthcare more unaffordable and more inaccessible for families, with double-digit increases in my home state of Louisiana, a 25% increase in health care costs for hardworking families over what they were paying last year. And last year we saw costs going up again because of all of the unworkable mandates and taxes in this failed law. And so there is relief. There's help coming. Our committees have been working on this. Our committees have actually been engaging governors in this process, hearing from people all across the country that have really good ideas about how to put the control of healthcare decisions back in the hands of patients and focus on lowering costs. It's exciting to see that we've listened to Americans and we're actually doing the hard work. And this